Despite recent warnings printed right on the tops of prescription bottles, the CDC estimates 130 Americans die every day from an opioid overdose.
Given that the addictive properties of opioids, you become addicted after not even the full prescription bottle, and then all of a sudden you're stuck and you're like, oh wait, I don't feel very well because I don't have my medicine, right? But that's actually a withdrawal, which people may not know of that.
DEA 360 training is a three-pronged approach to combat heroin and opioid use. Law enforcement take action against drug traffickers working to divert misuse of prescription drugs by empowering communities to take back their affected neighborhoods. It's only offered to areas hit worst by the opioid crisis, and now it's come to Utah.
Particularly in metropolitan areas like St. Louis or Charleston, West Virginia. But Utah is unique in the sense that we have it statewide.
Representatives from the DEA and Community Anti-Drug Coalitions of America joined for a day-long training at Dixie Tech in St. George. They're here to talk about the risks of opioid addiction.
We have law enforcement, we have medical providers, we have treatment, we have school, substance abuse. We have sectors from all over. We've reached out to all the community members that we could for this training.
While statistics for opioid overdose deaths appear to be going down in Utah, the number of calls for overdoses are still on the rise.
I actually pulled statistics on overdose calls through the last year. As of the 16th of this month, I think we're at 166 from as of last January of 2018. So it's definitely increasing.
There's also the illegal side of that, or misuse and abuse of opioids and heroin. Many believe incarceration is the first step to help those who are addicted so they may move on towards treatment and recovery.
When I see an addict that's arrested and brought into our facility, I know it's going to be a long, drawn-out period of time before hopefully they're going to realize that they're an addict and it's something they're going to have to live with hopefully the rest of their life. And when I say hopefully, I mean that they live, not die. Because if we just keep letting them go and going back out to reuse again, that's exactly what will happen. You heard today, 90-some-odd% of those that overdose, if they don't do it fatally that time, the next time it's going to happen. So,
first responders are trained and carry Narcan in order to save lives.
If they're overdosing and we get there first and we can administer Narcan and bring them back till the medical staff can get there, I mean, that's a tool in our belt. It's not really going to solve the problem.
The problem of addiction usually starts at a young age. Group discussions addressed how to get to the heart and minds of youth or others who may be at risk.
All of a sudden their friend overdoses and dies on something, and they had no idea that that could even happen to them. And so how do you make that education meaningful to them?
Exactly.
That it actually sets in to where they'll take that to heart.
A safe place for communication and education within that strong support system, like a family, is key in prevention.
Intervention to increase protective factors and decrease risk factors.
Social media has also sensationalized drug use, and it's sometimes glamorized in music.
If we're able to get our youth to critically think and kind of break down some of these hyper-sensationalized themes that are being produced in our society, I mean, they're that much more empowered to be like, you know what, like, that's lame, honestly.
The training addresses how to diagnose what's causing the use and or abuse from a community-wide perspective.
And so you need to uncover and diagnose what are those conditions in your community that are enabling the substance use behaviors you're seeing, and how can we remove them from our community.
Then the focus is to help those affected to move from addiction into a recovery.
There's always that warm handoff where, okay, this person experimented, now they're kind of experiencing, being addicted and helping them to get into the treatment that is needed, and then helping them to find support systems and avenues for recovery.
The training empowers responders what to do during a crisis.
This is a mental health facility. This is a hotline. Go to USARA. Or call the social worker at a hospital. Just being aware of those 4 things can make you that much more empowered in fighting the crisis at hand.
The leading cause of death among Utah's youth is suicide. Studies are now showing a link between suicide and substance use.
And that's something that isn't commonly put together. The risk factors do overlap, and so I hope that people take home what the risk factors are and how they relate to opioid use.
Each community must be willing to erase the stigma surrounding the problem and address it.
This is something we don't do, and a lot of people are suffering in silence, which is terrible.
Addiction itself isn't something that should be handled lightly. We need to be understanding to it, but we also can't enable it.
To try to lessen the amount of people that are victims of a fatal overdose, but more have opportunity to potentially get into treatment and hopefully go down that road of recovery.
In St. George, Melissa Anderson, Community Education News.